Hey, it is almost 4 o'clock. It is me, Mance, owner of Mia Talks Media. It's my favorite time of the week. I invite amazing people to come on and talk to you about things that really, really matter. And things, especially right now, for all of you new mamas or expectant mamas. So maybe you're on baby 2, 3, 4, 5, 6, yay. Or your first baby. The realities of bringing life into the world of COVID-19, right? You're excited, you're blessed. You're like, if there's something good to come out of COVID-19, it's you going through your journey of motherhood. But you're also dealing with a lot of anxieties, like can your husband or partner go with you to those OB appointments? Or who do I pick to be in the delivery room with me? Or I've heard about doulas and midwives, but like, so what do they do exactly? And how do I hire one? And what should I be looking for? Or I've heard about preeclampsia, and I've heard about it even if it's on reality TV or close friends. Well, we're going to take on those issues today. I'm so excited to welcome with me. Let me start here. And y'all knowing these ladies, if you are in the Savannah area, these are rock stars. I am starting with Victoria Buker. Victoria, let me bring you on to introduce yourself. You're an amazing mommy. You've done some great work in terms of maternal advocacy. Tell everybody your story, your history, and what you're doing these days, please.
Sure. So Mia, thank you again for having us on today. I'm Victoria Buker. I was in the Savannah area for about 12 years. Now my husband and our 14-month-old daughter, we live in Reno, just outside between Reno and Lake Tahoe. And I left my 15 plus year career in the nonprofit world after developing severe postpartum preeclampsia, partial HELP, and an infection that was turning septic at 9 days postpartum. So I really took this past year to focus on my postpartum health. And within that, I found a community and actually founded and am now the race director for the 140 over 90 run. Which we'll talk about in a little bit, but that benefits the Preeclampsia Foundation. And I really have gotten involved with maternal health and advocacy, especially on the preeclampsia side and also the mental health side. So I'm very excited to be here today to chat more about preeclampsia and also the mental health aspect of pregnancy and postpartum life. So thanks for having me on.
Absolutely. And Lauren, you are the birth doula. Let me get your information up there. Go ahead and tell people some of your backstory and how you got into the work of becoming a doula and some of the things that we'll get to hear from you today, please, Lauren.
Absolutely. Mia, thanks again for having me on. I'm super excited to talk about birth work and also how I support new birthing persons, moms, single persons, etc. So by trade, I am a certified senior human resources professional. I am a consultant. I've worked in trauma centers, academic medical centers in the HR world. I support and champion diversity and inclusion, and I usually work in the field between employee relations or have served as even director of talent acquisition and recruitment. Currently, I wear two hats. I have my HR world where I'm full-time, and then I'm also full-time as a independent contractor with the Doulas of Capitol Hill. So I serve as a birth and postpartum doula where I assist new parents, be it a mom and dad and what we know as a typical heterosexual household. I also work with single moms. I work with LGBT and the trans community. So all birthing persons, all bodies, all genders, all races. I support all of those who bring life into the world, and I support them in the home, virtually, and with prenatal care, all the way through birth and delivery in the home as well, also in hospitals or birthing centers. The last phase of that is the postpartum care, where I offer support in the home, assist with breastfeeding, chest feeding, and ensuring that the birthing person and their family are now able to welcome and transition into life with this new addition, this healthy, happy baby. We work on sleep hygiene. I also am trained to look out for cues for postpartum and mood disorders and how to refer those out. So I look forward to talking with all of you today about how doulas are beneficial, what we do to help birthing persons before, during, and after labor, and how that sets up the entire family for a healthy transition and a start into the first year of life.
So this is going to be a jam-packed show. Please definitely hit the comment your questions. I do have to say hello to Cherie Styles. She's tuning in. She literally hit the comments before the show and was like, 5 of my besties are pregnant. This just for everybody to tune into. Shares with mamas and families that are expecting or look forward down the road to having their babies. Please share. I do need to do some disclaimers and let you know everything that you hear on this show. When you hear it, please reach out to your own primary care physician or midwife or doula to follow up with you what you have heard here. Again, I want to make that disclaimer very clear. Please reach out to your own healthcare professionals. If you are seeking advice post the talk, you will have tons of contact information to connect with these ladies. I do want to say thank you. You guys have made these talks just everything good and just embracing and sharing so much knowledge and power with each other as we live in this time of COVID-19. I do want to say thank you to the David Pence Allstate team for tuning in. Thank you, Angela. Thank you, Tammy. Thank you, David, for caring about the success of our communities and the success of moms. Also, if you get hurt in the time of COVID-19, call our law firm, the Mance Law Firm, 912-574-LAW. All right, let's get into the contents here. Let's start with, for expectant moms currently, what are some of the realities, ladies, of what it's like to be an expectant mom in the time of COVID-19 when it comes to doctor's appointments and just the monthly, you name it, unexpected things that can pop up, please? Who wants to take that one on first?
Sure, I can start real quick. What I would do, and this is based from some advice from the Preeclampsia Foundation, is start by you have a photo, hopefully, of yourself. That way, because your doctor, if you're doing telehealth or if you have a large firm practice you're going to, you might see different doctors. So I would suggest having that photo of pre-pregnancy or your first few weeks. And that way you can tell if you're having any of that facial swelling, which is one of the signs of preeclampsia, but also keeping a journal of how you're feeling. So when you're talking to your doctor, you're not forgetting things. You have everything written there out for all of your appointments. Make sure that your phones are charged for appointments. I've heard of moms not having their phones charged and they get kicked off of their telehealth. Things are different, but also trust your gut. That is the biggest thing that you can do right now, is trusting your gut during this. And if you have to be seen in person, really making that clear to your provider that you need to be seen in person. This is what's going on. I know my body, and can I please be seen, or have another telehealth or something like that. But mainly right now is making sure you're staying safe and listening to what your providers say. For me, pregnancy was not fun. I did not enjoy being pregnant. I had gestational diabetes and ended up being dependent on insulin. And I also had group B strep. So it was a lot for me in my pregnancy that I had to go through, but the outcome obviously was beautiful with my daughter, Madison. But really just seeking the advice of the professionals and other moms. There's a bunch of groups out there, and I'm sure Lauren can talk too about that. And also my doula was an amazing support system for me through that.
Excellent. So Lauren, before we even jump into your answers about what you're seeing in the delivery rooms right now, can you define, because I think we take for granted that everyone knows what a doula is or what a midwife is. Can you please firmly define the role of a doula and the history of doulas so that people in listening to you know exactly how you're serving families, please?
Absolutely. So a lot of people are very concerned about just knowing what a doula is, or they see the word and don't even know sometimes how to pronounce it. So a doula is the person that assists with 3 types of support. Doulas offer educational support, informational support, and physical support. So we are offering that in conjunction with being physically present. We are emotionally present, and we assist the birthing person as well as their partner. So it could be a couple, it could be the new mom, or whoever she or he chooses to bring into their birth room. We assist them in guiding with advocacy. I am not the one speaking on behalf of my client or the patient. I assist in educating them and providing resources to equip the birthing person with the knowledge, the language, because we all know medical language can be overwhelming. You hear a lot of things in the doctor's office. So we make sure that you're equipped as a doula, you come equipped to educate your client on how to speak up, to amplify their voice, and how to speak up and ask the questions so that you make choices for you and your baby with informed consent, informed refusal, and that you know that you have options. So again, it's about ensuring that the doula works collaboratively with the care team once we get to the delivery room. So I work with the doctors, I work with the midwives, and I work alongside the nurses to make sure that my client is healthy, that they are able to speak up and ask questions, and that they fully understand and can comprehend what services are available to them, what choices they have to keep themselves safe and their baby safe if they choose to have a natural or a low intervention birth. So that process starts well before you make it to the delivery room. As a doula, I may begin supporting a client in their home or virtually, even into their 7th or 8th month of pregnancy. Usually around the end of the 3rd trimester, I'm going to be coming into the home or doing virtual visits. In COVID, we know things are different. We want to be very precautious. So before I even go into the home, I discuss those concerns. Personally, I go and get COVID tests every 2 weeks before I go into the home of any of my clients or before I go into the hospital. Many hospitals are only allowing one support person. If you're fortunate that your hospital allows 2 people, you're more inclined to have both your partner as well as your doula. So I am able to now, in light of COVID, still be supportive. I'm still able to expand and even open my client services to folks that are local to me, where I am in the DC area. That was part of your earlier question. Mia, I just want to touch on that. I lived in Savannah, Georgia for 7 years. And after spending wonderful time there working in healthcare and in the hospital, shout out to the team at Memorial. I transitioned to Washington, D.C., where I served as HR and talent acquisition at George Washington University Hospital. And I transitioned most recently to being a consultant for Kaiser. And I work from home, but I'm able to, that gives me the freedom to also become that client support as a doula with the Doulas of Capitol Hill. So we're seeing many clients virtually. That expands my reach beyond just those right here in the DC area. So I talk to clients all over East and West Coast. I'm able to do phone and FaceTime or Zoom calls. But for those where I'm able to be in person, I show up in the hospital with my mask. I follow those COVID screening guidelines, and I am usually in my mask the entire time. And I am right there coaching, helping, supporting, and speaking up for my patient or my client from the time that we check in at the hospital until they give birth.
Lauren, okay, so this is real life. You literally, like just a couple of hours ago, came out of a 37-hour people birthing experience. I don't know if we can even have enough time to take on all 37 hours, but tell me what you and the family and the new baby that's in the world just walked through, please, Lauren.
Yeah, it was a beautiful, beautiful experience. We spent about the first 16 hours on FaceTime at home. Again, just for COVID protection, my safety as well as theirs, and any other family members that were in their home. We did a lot of check-ins at first, starting out every 2 to 3 hours as they're going through early labor. So we go over some very specific and easy comfort measures. I stay on FaceTime with them as they move throughout their home, coaching them on some positions to get in, coaching them on breathing, talking to them about what to anticipate as we're building momentum. I know that the pain that they're experiencing early at around 5:30 or 8 o'clock in the morning, I knew that was going to be very different when we reach active labor. So I'm coaching them on how to get through some of those early pains. I gave them some advice. I sent them for a walk. They took a hot bath. I also encouraged them to have some intimate time, because that oxytocin, those love hormones, really help to advance labor, and it helps the birthing person for their body to prepare. So I coach them on setting
Say that again, the oxytocin. Somebody needs to write that down, or like hit the comments, or like, hey, here's what I learned, because those are so good. Say that one more time about those love hormones helping moms to calm down.
Oxytocin. So all of those hormones that are going to be released in
Mm-hmm.
moments of passion. I know there's some adults watching, but just to share, when you're intimates, okay? So when you have an orgasm, there are lots of hormones and things that stimulate good feelings and will bring ease both to your mind and body that help you prepare your body for labor. So the hormones even that are exchanged through those secretions during intimacy, that helps to prepare the woman's body and her cervix for an easier labor. So things that are very fun, aromatherapy, candles, music, I encourage all of those things to be in the atmosphere when active labor happens in the hospital, but even in those precious hours at home. So while the parents are still able to talk and make eye contact, that's a great sign. It means you need to stay home. So typically, I encourage my clients to stay home as long as possible. And we want to wait until their contractions are between 4 to 5 minutes apart before we look to transition to the hospital. There's no one that has a calendar or a clock that's in the womb. Babies don't care what time it is. So the baby's going to do what the baby's going to do. So I spent hours with them supporting virtually. And then we actually were together for about a full 24 hours in the hospital. So we slowed things down a bit. And then they started to speed back up. But we were with a group of excellent midwives. Shout out to GW Hospital Midwives. But we were with a group of providers who believed in allowing that mother and her partner to have that space to let her body do what it needed to keep baby healthy. She committed to a plan for a natural birth. She did not want to have a C-section. So we allowed her to stay healthy and comfortable. And we moved in the progress that the baby was healthy and that rhythm. So about 24 hours into it, we had periods of rest, periods of food, and, some jokes and laughter, music, dim lighting. We set the atmosphere so that birthing person, that mama, was in control. And I was able to remind her to ask questions before that IV bag was hung, before they did another check. So I remind them that this is your body and you're in control. You do not have to permit that nurse, that anesthesiologist, that doctor. They don't have to touch you just yet if you need a minute. If you're in the middle of a contraction, it's probably not a good time to have a conversation about what you want. So we did have a birth plan in place, but I also know that it's important to have code words so that if things change, there's no surprises. If you reach a point of exhaustion or you reach a point of too much pain, we know when it's time to discuss what those plans B, C, and D are. So I do a lot of conversation and getting to know my clients. So we're able, in light of COVID, we know that they may not have every person in the room that they want. But I also am capable of using my iPhone to text or send a group chat to keep folks informed. Sometimes I'm taking pictures for them or videotaping. I may go and help move the car if you're in a city and parking's an issue. I may have, someone bring in food for us, or I'm coordinating to keep everything that birthing person needs as a worry, almost the way that a wedding planner keeps the bride from stressing the day of. I'm the person helping to make sure.
I love that. I love it. So
yeah, go ahead.
What you were saying, so it's having a birth plan, having an A, B, and C, having those code words so that you guys are having these conversations, because as you can see Amy's feedback, she says, I wish someone had this talk with me 4 months ago when I just gave birth to my new daughter, right? So this is part of why we're here, is to set up those plans and to be able to have these conversations right now before you make it into the delivery room. You're talking about setting the atmosphere, how you need this to feel, what it needs to feel like for you and your partner as you take this on, how you want it to feel, as opposed to it just taking you for a ride. And I want to Victoria for a second talk about, because if I'm allowed to share, I knew early on when you were pregnant, right? And there were some high-risk things that you were slightly worried about, and some tests that you had to get through, and some medications you had to get off. So let's talk about the anxieties of if it's your first pregnancy or you've lost pregnancies and now here you are at 12 weeks, or you're concerned about your placenta, you're concerned about your age, certain things. Let's talk about that anxiety that often pregnant women are carrying, because everybody is like, we're so happy, the baby's coming. But just walk me through how you handle that anxiety, please.
Sure. So I dealt with my anxiety throughout pregnancy by staying as active as I safely could. And to kind of touch base on what Lauren just mentioned too, I had a doula, and she was amazing. But I couldn't birth at home because when you do test positive for group B strep, as soon as your water breaks, you have to head into the hospital for the safety, not of just you, but mostly the baby. But you can, I just want to make sure moms know that when you get to the hospital, like Lauren mentioned, you can set the scene at the hospital too. My doula had candles, much like Lauren was talking about, the candles, the oils, whatever. I had a birth plan A through Z. I told Mia before I got on here, like I went through the whole birth plan, and my code word was watermelon. And you better believed it. I was screaming that shit from the top of my lungs by the time I was like, epidural. And the doula was like, are you sure? I was like, watermelon! Like so loud. I think the whole floor heard me. But so the anxiety was there. I'm an older mom. I'm geriatric age. I ended up having gestational diabetes, which is nothing the mother does wrong. I've heard it from you were a little overweight, you didn't exercise enough. Are you sure you're eating healthy? That's why you got it. That's not the case. It's all about how your placenta reacts to your body. It's a foreign substance inside your body, and this is just how your body's reacting. And so it was hard for me every day having to do insulin shots and blood draws, finger pricks after every meal, making sure you have the carb to fat to protein ratio. So not being able to do that typical, like sitting there, pickles and ice cream, because otherwise my blood sugar would spike up and I would fear that my daughter would, something would happen to her because of what I was eating. So controlling the anxiety a lot also was through therapy. I started going to therapy. I started using acupuncture, going on more walks, and really just talking to my provider about what I was feeling and just hearing that my feelings were validated through that, and making sure that I spoke with my doula and getting through the birth. But also, I thought once I went through the amazing birth, I labored for about, I think it was 28 hours. I was done. It was a beautiful birth. Everything went as much as it could according to plan. And then that's when kind of everything hit the fan for me. And then my anxiety really took up in postpartum period. But during it, I feel it's hard because you have this beautiful life growing inside of you and you want to do everything the right way. And everyone is going to have an opinion, whether you would like to hear it or not. Yeah. On the internet, in the store. I remember giving Madison a bottle afterwards. And someone's like, oh, you're not breastfeeding. Why aren't you breastfeeding? Some stranger at the grocery store. And I was just like, right. And I was just like, well,
how do you deal with that? Because I do feel like a lot of expectant moms and new mamas are getting judgment and opinions left and right. How big you are, what your bump looks like. You're not bumping enough. You need to do this. You need, why, like you said, you're not breastfeeding. Maybe something's wrong with your nipples. There's a lot of things. What do you ladies say to your, to moms and to yourselves when the whole world's coming at them about their pregnancy?
Depends upon the day for me. Like what side of the bed I woke up on, so how polite I will be. Like if I'm gonna have a bless your heart type situation, like, oh, well, thank you so much for your advice. Or if I'm going to go into, well, I actually almost died 9 days postpartum and none of my milk came in. So I'm really glad that Fed is best. And there's formula out here to make sure my daughter's healthy and thriving. Thank you so much.
Excellent. So
either or.
Victoria hit on all the things that I was going to say. As a doula, from day one, I tell my clients, it's your birth, it's your baby, and it's your body. So I prepare them in some of our prenatal and coaching sessions. I let them know that even for my LGBT or trans parents, or even for parents that may be even, at the older end of their birthing lifespan, there's judgment that can come. But the purpose of the doula is to help fortify that mother, help fortify her with confidence, provide those birthing persons with the words to use so that they know how to create space. We hold space with intention and with our language. So if you're confident and you know that you're making the choices, you feel armored and equipped with the language and resources from your doula and your care team to do what's best for you, you can adequately say to someone without even batting an eye, well, this is actually what's best for my baby. My child has an allergy. You really give no explanation if you don't want to. But if you do have loved ones, we know folks come into the room with assumptions, which is why, let's be honest, some birthing persons decide they'd rather have their doula in the room than their mom or their mother-in-law, because oftentimes people bring their traumas into it. So we hold space to acknowledge if you've already given birth before and things may have gone a different way than what you expected or wanted. There could be some fear associated with certain things. We, as doulas, those that are holistic and natural, I am an all-inclusive doula, and I believe in advocacy, and we believe that many people are survivors of trauma, whatever your trauma is. We know that there are a lot of statistics that show for both Black and brown women that there are numbers that aren't even reported of sexual abuse, molestation. There are things that as people and as women, no matter where you're from, no matter your age, you come to the table with a loaded suitcase full of things that you bring to the table before you even give birth. So you have every right to do all the research, to fact check, and to shop around. The same way you go on multiple job interviews before you decide it's the right fit, the same way you decide if you maybe want to go on a couple dates before you decide it's an exclusive relationship. Well, you have that right with your provider. You have that right with your team of doctors. You have that right with the hospital. So I believe that no matter whether it's repeat that.
I'm sorry, Lauren. Y'all just gave everyone permission slips to do what's best and what's right for their pregnancy. And I like just hearing that freedom, because I do, and I'm going to jump around a little bit because Victoria, you were taking us down the postpartum journey, and I want to sit because I know that is such a heavy space, and that needs to have more light shed upon it. And I'm just thankful that y'all are giving everyone permission slips. As you see Alondia here, we all love her as a mom and her son Nolan. That unsolicited comments and questions hurt the feelings of new moms who have so many hormones and other feelings rushing through them. It's like, let's not add layers to that. So Lauren, I'll let you finish up what you were saying, and then Victoria, take it back to the postpartum conversation for me, please.
Sure.
Yeah. So Elandia hit the nail on the head. Hi, sweetheart. I love your candles. I have them burning. But I just want to say that, but yes, we love supporting each other. So with the doula's role, again, is to remind that birthing person at every encounter that your voice is the one that's to be heard, not mine. I'm here to be that reminder in your ear to help you understand what to say and when to speak up. And if I'm seeing that there's not room in that delivery room where I don't see that birthing person being heard, sometimes it's as simple as waiting for those providers to leave the room and we do a quick huddle. Just yesterday, while in the delivery room at GW Hospital, I had time with my client and her husband where we discussed exactly that. Remember, when they come back, if you're not ready for that, ask before they do that intervention. Feel free to ask another question. If you don't remember which part of the birth plan we decided these were our options. So let's ask them a little bit more about doing this before they do that. So that's the kind of things that we do to keep them safe, but also to remind them the power is yours. The power is yours. So when it comes to postpartum, I know Victoria's going to touch on that, but it's also important to do pre-planning and discuss what those stages and warning signs can be so that the partner is aware. And I also do lots of self-care checks, and I have resources and handouts, and we go through check-ins via text and phone. So I'm always connected to clients. Literally right now, I'm getting some contacts, but I'm always willing and able to answer questions and give reassurance so that birthing person knows at every time that we have the opportunity to make a choice, that is a time for you to say, let's pause and slow it down so that I can look at my information or consult my doula, talk to my partner, and decide if this is the way we want to go for this route. Every choice leads to another and leads to another. And there's a lot of ways that the doula helps them balance and recalibrate if they get to a place where they're a little concerned or have some questions and uncertainty.
And I can't even say thank you enough. Literally, when you're like, the power is yours, this is exactly what this conversation is about. For you to know how much power you have during your pregnancy, into the delivery room, on the other side of it. Victoria, go ahead and take over about your own postpartum experiences and the things that people never told you.
Sure. So I would say the never told was birth went amazing. We left at day 3. Everything was great. We were, breastfeeding was going as good as expected. And my daughter didn't have a wet diaper around for over 24 hours. So I started supplementing, of course, freaking out, sent the family to Target real quick at like 2 a.m. to get, formula because we've been having it in the house. I thought I'd be breastfeeding. And I quickly was realizing, despite what you Google at 3 a.m. while you're trying to feed and figure out how to attach this kid to your breast, everything I Googled seemed like new mom issues. I was starting to swell. I was feeling this wave of nausea, this impending doom. I just wasn't feeling good. I felt literally like I was dying because I was. And I didn't realize that. And I went to 3 doctor's appointments. My blood pressure was slowly creeping up. I usually run the low side, like 105 over 65. My blood pressure was right under that 140 over 90, which is the preeclampsia threshold. And it finally wasn't until day 9, or day 5, lactation consultant, when she thought that maybe I had some retained placenta because something wasn't right. I was telling her my symptoms. She's like, this isn't right. I was dismissed again by the doctor. Day 9, I went again for a follow-up, and they didn't tell me it to my face. They just said, go get a blood pressure cuff and call if it gets high. Okay. I'm an educated woman. I have access to transportation. So I could get a blood pressure cuff. I've also access to $30 if I needed to. So I also put myself in the shoes of someone who doesn't have access to transportation, does not have an extra $30 to get a blood pressure cuff, might have other kids at home to care for, and could put her health at the wayside. I got in the car. My husband and my mom and my daughter were in the waiting room. The doctor never asked to talk to them. She put it in after visit summary, which is all online, which I didn't see till 3 months later because I didn't look online. And got the blood pressure cuff, even though I didn't want to. I just wanted to go home and sleep. And by 4 hours later, my blood pressure was 218 over 108. I was in critical stages. My levels had raised up. I was in hemolysis, which is where your red blood cells are breaking down, so partial help. And I was about to turn septic from an infection as well. So I was hospitalized for 4 days on the magnesium drip, which is what to prevent seizures. I had the pads on the railings of my bed, so in case I did have a seizure. I had edema level 3+, which is almost the highest level of pitting. You can put your finger down almost over half an inch into my skin, and it would take about over 30 seconds to pop back up. That's how much swelling I had. Gained almost 30 pounds in 9 days of swelling. I wasn't feeling good. So that being said, postpartum preeclampsia is 75% of postpartum deaths are due to postpartum preeclampsia, and 60% of them are preventable. So when I called the on-call nurse, I was told I wasn't taking my blood pressure correctly. It was a new cuff. Or maybe just call back in a few hours or go to sleep. We'll see you in the morning. Had I gone to sleep, I could have had a stroke. I could have died. Something more tragic. Okay, not more tragic than death, but something else along those lines. Okay. So I'm a firm believer in I listen to myself and my body, and also my mother or my husband being like, no, we're going to the hospital right now. But the postpartum part, I thought after I left the hospital, I'd be done. I wasn't. I had diagnosed with PTSD and postpartum anxiety. A lot of it centered around medical providers and not trusting. I was never told about the long-term effects, which actually 77% of preeclampsia and HELP survivors are not told, but the long-term cardiac effects. About 3 to 4 of us will have a heart attack or heart disease in our life over just a normal woman without having had preeclampsia. We're more apt to get diabetes, eye issues, liver, kidney. I've had 3 kidney infections this year, hospitalized once for one. My liver enzymes were all over the place. My A1C just went down. So it took a whole year of hard work to get my body back to where it was. And I don't mean like body back, girls looking good in a bikini, because girlfriend was never looking good in a bikini, but like my body internally back to where it was. And mentally, I'm still not there. I still see therapists. I'm doing EMDR for my PTSD to build trust again with medical providers. I have a team of over 11 that I work with for all different issues that all stem from preeclampsia. And I wish that postpartum was more talked about. I didn't know. I mean, Mia, you know me for quite a few years. Lauren, we're just meeting, but we're besties now. So, hey, I've always been very go get 'em, whatever. And I left my career of over 15 years in February. I couldn't handle it anymore. I was working from home. It was one bad appointment after another, more bad news, another specialist to go to, and I couldn't physically do it anymore. And leaving a career, which was so much of my identity, to me was really the turning point of my mental health to be able to turn around, to really focus on myself. And that's what I need to do. But I also recognize the privilege in that I was able to do that and care for myself and get into therapy, because therapy across the nation to find someone that's certified in PMADs, which is perinatal mood associated disorders, is hard. But, 1 in 7 women will have a PMAD, 1 in 3 women of color, and 1 in 10 men will have this postpartum. And because it can happen to the fathers or the spouses.
Thank you for saying that.
Yeah, no, it definitely can. And, go ahead.
Can we talk about trust? So if you've had issues with trusting your OB, if you and maybe they didn't even know that you were pregnant with twins, so you only thought you were pregnant with one, and then you're like, wait a minute, how come you didn't even know that, or things like that. So there's already distrust, right? So if there's a trust, and again, I want to say this disclaimer that anything we discuss, please follow up with your own physicians, please follow up with your own healthcare providers. How ladies do you trust? Because one thing we're not told enough is to listen to our guts, right? So if my gut's saying this is off, I need to get a new OB, I need to find another midwife or a doula, or I've now been sent home and I know that something's completely off post my delivery. How do our parents trust themselves and then establish that much needed trust in this process?
So Laura mentioned before interviewing. So I have interviewed now 4 OBs. I have a book. This isn't it, but I have it on Google Docs where I go in with my highlights of what I need. I start every conversation with every single doctor. This is from my therapist. If you're going to tell me to lose weight and eat healthy, you're not the doctor for me. I work out 5 to 6 days a week and I eat pretty damn healthy. So let's talk about my lab work. Let's talk about the mistrust I had when I almost died because the provider didn't care for me. When I asked for tests and was denied tests, that I had insurance. And even if I didn't have insurance, it was a simple blood test that you could have run to see if I just had a effing heart attack while in the hospital, because I had all signs showing that I had one, and was denied that. So so I bring it up. I just talk about the elephant in the room and why I'm there. And I get really sweaty and really nervous doing it. But I come in there listing it out. And I'm like, I set the stage. So I walk in there and I wear my lucky underwear that day. That is my interview underwear. And I'm like, so this is how it's going to go. There are other, doctors here, MFMs, OBs, whatever. And I have a team and I found a really good internist here. So I don't go to a general practitioner anymore. I go to an internist. They know how all the systems work. And I'm like, who do you see that's a nutritionist? Who's your endocrinologist? And then I go from there. And if I don't like them, then I just keep getting recommendations. You just have to go in like a boss. I feel like that's what's worked for me. And do your but research is hard. And it's time consuming. So I am always open. I know Mia's to give the contact. I'm sure I'm not going to speak for Lauren, but I'm sure she is too. If you need help finding people in your area, whether it's for perinatal mood disorders or different specialists, or I'm happy to talk you through that. Again, not a doctor, but it's research is hard as detailed to find something, but happy to help anyone that it could help save a life.
Yes. Victoria touched on a few things that I just want to also highlight. So first of all, doulas are a lot of things. What we are not, we are not clinical. So I don't give medical advice. I don't prescribe. I don't diagnose. I don't examine you. What I will do is provide you with evidence-based theory. We know that before modern medicine, before technology, before Facebook and Zoom, there were women, there were birthing bodies giving birth, right? Whether it was in the woods, in a jungle, in a desert, on a reservoir. And for our ancestors in Africa, or even when they made it here, it was on a plantation. We had everything within us and in our bodies to do what our bodies needed and to provide that for our baby. So what that means today, touching on just the statistics alone, I want to take a minute just to hold space for the disparities that exist and acknowledgement and an awareness of what happens to Black women at a rate alarmingly higher than what Victoria experienced. This is not at all to diminish what Victoria just shared, but I want to take just 2 seconds to also highlight some very important information. The CDC's pregnancy mortality surveillance system defines a pregnancy-related death as a death that happens within a year of pregnancy, while the National Center for Health Statistics uses the WHO's definition, which is 42 days. So we're looking at any time between birth and 42 days, or according to the CDC, 1 year after birth. That is postpartum, that entire year. As a doula, I can be with someone from their 3rd trimester during birth and all the way through postpartum care as long as they need. Whether it's 6 months with the client, maybe it's 6 weeks, maybe it's a whole year. But ultimately, the alarming rates for Black women, I will go ahead and let you know that Black women are actually coming out at a much higher rate on the losing end of things. So I just want you to know that from 2007 to 2016, Black mothers died 3.2 times higher than that rate of white mothers. Hispanic mothers also had the lowest rate. Hispanic mothers at 11.5% pregnancy-related deaths, 11.5 per 100,000 births, slightly less than that of white women. So I want you to know that there are there's studies, there's research about medical racism. There are statistics and articles on my Instagram and also on my Lauren the Birth Doula Facebook page. You will see some of that data. I share news articles just this week. This week alone, Glamour Magazine, People Magazine, CNN. There are articles everywhere discussing it, both in print and in the web, on all news outlets, discussing the alarming rates. That the same way we see the way, let me get the quote right. The same way police are harming Black men, doctors are having that same rate and effect on Black women. So the protection that is needed, the role of a doula is to arm and equip a birthing person, no matter of your race, creed, religion, your gender, your insurance or not. Because I want to say that I do work with very many people of color. I work with all families. I work with all birthing persons. But if they don't have the ability or the financial capital, because again, doulas are not covered by insurance here in America. That's another conversation another day. But I just want you to understand the medical model and insurance. The system works, but the system has been designed to do what it's doing, which is to keep doctors, pharmaceutical companies, and all of those in big pharma. They're getting their pockets laced. And I love my healthcare professionals. I love them and respect what they do. It's a reason I didn't choose to go to medical school. But the training and the indoctrination that they receive when they step into the delivery room or even in that medical office is going to have a drastic impact on whether or not they are moving you almost on an assembly line, where you see different doctors every time. You may have a different doctor that does your delivery. Well, the benefit of having a doula is that even though at that hospital for the last 2 days, the clients that I was with, they got a new nurse at 7 a.m. They got a different nurse at 7 p.m. The midwife, a different one came at 7 a.m., a different one came at 7 p.m. But guess who was by her side for that continuity of care? The doula. Okay. I don't break my relationship with that birthing person. I don't change out. So the energy that we invite into that space is the energy that's maintained, because I'm ensuring that what we talked about at 37 weeks, we're sticking to today. And the things that were important to that birthing person, I'm not going to compromise it just because the anesthesiologist has to get down the halls of 2 or 3 more people and they need to give relief to the next person, or because the intern or the resident with them has a few more questions. I'm still making sure I hold space. I pause. I make eye contact with the birthing person and I say, did you understand that? I know you were having a contraction. Did you hear what they just said? Did you hear it? Did you get your answer? And if they did not, then I will then speak up. But I talk directly to the client, and I let that patient speak to her providers, speak to the nurses, speak to the doctors. Or if that birthing person's unable, I make sure they ask the questions, because when you feel something, you trust it. If you don't feel right in your gut, or if you're feeling uneasy about something, even when I go in the home with my postpartum clients, literally just while I was getting ready to go to the hospital for birth on Monday, preparing as I knew she was getting close, I was on the phone with a postpartum client, just touching base with her because her 5-week-old that I still have on my heart and in my mind, even as I'm working or taking my HR calls or I'm in meetings, I carry these families with me because they're my clients, and I want to make sure that they have that continuous emotional support. Don't feel judgment. Ask the questions. If you don't trust something and you don't like the way it's going, get a new doctor. The same way you go to CarMax and there's a million cars, or you can browse online and you can shop around. You have that very right with your provider. And if you don't like the hospital's rules, guess what? Find another doctor that can have that baby delivered at the hospital you want. So again, the Doulas of Capitol Hill is the agency that I'm part of. We have a sister organization, the Doulas of PG County. And here in the DC metro area, there are a number of solo practitioners and doulas that work in collectives. But the ultimate thing that I want someone to know, even if you don't work with me, I would love to work with as many people as I can and help bring life into the world. But even if you don't choose to work with me, I beg each of you, if you are not the person that's pregnant, but you have someone in your family or one of your girlfriends is, encourage them to speak to a doula. Find out if that doula is all inclusive. Find out if it's a full spectrum doula. Find out if they believe in holistic care. Even if you plan for a C-section, even if you want to have an epidural, it doesn't matter. I work with clients that want to do whatever's best for them. And we cultivate an environment and we protect the energy so that they don't feel at any moment they cannot ask a question. If they don't feel that they're heard, I find somebody else.
And this is so good. I have to put to you Amy's comment here, and thank you, Shablo. Thank you, Alondia. Alondia was saying literally Black women are dying on the delivery table every single day. We are going to get into the Moms Act, and I want to identify that in 1 second. There are a lot of, I know I reached out to the Georgia Midwives Association to be a part of this talk and to tune in, who are advocating and asking other people within the birthing professions if they are nurses for those same protections for doulas and for midwives. So we're going to take on some of that legislative conversation here in a second. But Amy shared, she said, my last baby wasn't gaining weight after being discharged from the hospital and was actually losing weight instead. To find out about it almost a month after she was born, she felt so lost, and she wished that she had been able to immediately have these conversations with nurses and doctors about feedings and different things. So I can't say thank you enough, ladies, for again having these conversations. And you talk about, because we're like, wait a minute, we have so many more conversations to have, and we're almost at time here in the next about 10 minutes or so. So let's get into the very real advocacy and legislative pieces that are designed so that we can reduce those maternal mortality rates. I know that here in Chatham County, our Chatham County delegation, Senator Lester Jackson, he's been very supportive of working with and bringing midwives and bringing doulas to the table to have those equal protections and care when it comes to being able to access the hospital. Can you, Victoria, for me, please? Let's get into the Moms Act and what that is asking, please.
Sure. So the Mamas Act is asking nationwide to extend Medicaid to a year postpartum. So women have access to what they need postpartum, but also extending and expanding mental health services. It can take quite a long time. The groups I'm in, whether it's online or through mentoring, it can take almost 6 months for a mom to find someone who's qualified in her area to be trained to talk to her through whatever she's experiencing postpartum. That is unacceptable. But also the barriers to access. Mental health can be expensive if your insurance doesn't cover it. Right now with COVID, telehealth. Some of physicians or doctors, especially mental health, want you to go in for the first appointment. So they're pushing back all new patients until after this is over. And that's not fair. We have moms who are literally crying and not enjoying an ounce of their motherhood right now because they can't see a therapist, or they can't find childcare because their therapist doesn't want them bringing a child into the office, which I understand of COVID, but still, like, there's things we need to do to help these moms. So That's hopefully will get passed in all the states to ensure that moms have access to care, access to reliable care. I also want to touch also on what Lauren said too. There was a CNN article that just came out 2 days ago that Black newborns are 3 times more likely to die when a white doctor is their doctor. And I think it was the same study, but a different fact that Laura mentioned in the 2007 and 2017. Our U.S. maternal mortality rate in 10 years increased 52%. So we are 55th in the world for maternal health care. Yet we are number 1 in spending per dollar on maternal care.
Facts.
Okay. So our Black women are dying. The CDC, Black women are 4 to 5 times more likely to die during childbirth or in the first year postpartum. From preeclampsia, they're 3 to 4 times more likely to die. It's unacceptable. So just want to also put my input as well and just reiterate again what Lauren was saying on that. But yeah, the Mamas Act needs to be passed in all the states, but also the mental health care. I know it took me a while. We moved when I was postpartum, but finding care, I had a spreadsheet because I like to be organized like that. 15 different places, and I had to follow up. And I went through Postpartum Support International, and they have a great text service where you can find people, but that doesn't mean the provider is always going to call back. Yeah. If I was a mom who didn't have the support system to handle that, I would be lost. Okay. So I really hope that mental health really and access to it really is something else that legislators really look for and will help with too, because our moms are dying from postpartum depression, anxiety, PTSD, OCD, obsessive obtrusive thoughts. And there are support organizations out there, but it's hard to find and it's hard to have access to sometimes.
Can you go over a few organizations that parents can look into, family members, friends, people that are expecting, that if they know someone that needs those resources and they're like, hey, I want to pass on this group or this information? Are there a couple of groups that you can share, Victoria?
Sure. So Postpartum Support International is a great place to start. They do every week. They have free Zoom calls. They also have it for fathers too, which is great. So if dads want to kind of bond together, and they also have a tech support that's 24 hours. We're a trained facilitator in your area. We'll respond back with a list of resources for you. There's also a group called the Penelope Project, which is for NICU parents, regardless if your babe was in the NICU for a day, an hour, or 365 days, whether it's happening right now or 10 years ago. This is a virtual support group that happens every other week, and you can Zoom with other moms and families, dads, and just talk to each other. NICU is hard. I did not have that experience, so I can't speak to it, but all my friends that have, it is hard. It is draining. There's no right or wrong way of how you handle NICU, but this is a good way for other members to help you, support you through that. I'm sure Lauren has a lot of others. I have a lot of preeclampsia related maternal near miss survivor and support groups too that are helpful. And my cell phone is always open. I had someone text me the other day that she was postpartum and she didn't know what to do. And 2 a.m, I was like, these are your symptoms. Just call your on-call doc. She actually got admitted for magnesium and she did have postpartum preeclampsia. So I feel like sharing stories really helps make other people know that it's okay to ask for help. Trust your gut. Always trust your gut. Ask for a second opinion. Really just go with what you know. You know your body best. You do. You really do.
Yes.
Lauren, what are your favorite resources that you tell moms to check out and groups that they can find support?
Absolutely. So for my role as a doula, we are just that person, as Victoria was talking about, when you're inundated with information and you have nothing but Google or WebMD and your iPhone or your laptop and you're home in a pandemic driving yourself crazy. One benefit of having a doula is that a doula can also filter and customize the resources that fit just for you. So I don't do a cookie cutter type of email drop. For my clients, I may do an email drop or a text drop with YouTube links, with videos, with also handouts or articles. Even sometimes it may be something as simple as a video or just a screenshot image to give them a graphic to understand whether they are experiencing something that is the norm or it's not. But I help to normalize the thoughts and the questions. But when you think of postpartum, I certainly recommend the exact same resources that she mentioned, but on a local level, you have within your county government, there are community service boards. Now, right now, I'm a resident of the Commonwealth of Virginia. I formerly did live in Chatham County right there in Savannah. And I know that depending on your leadership, depending on the government administration, also depending on what happens, by the way, let me pause to say, I need everyone that is on this call, that is tuned in, and everyone that watches the replay to make sure you register, make sure you vote early. Voting is essential and it is very necessary so we can have the people in place to help make sure that the Mamas Act not only is passed, but the Mamas Act is protected and expanded. We need coverage. We need those legislators that will create the opportunity for families, whether they have insurance or not, to get access to doulas, because I will customize the resources for you. If I notice that there is a single mom, or if I see some mood disorders, I see that there's some baby blues, or if there's trauma, I will customize and provide support groups based exclusively on what that birthing person is going through. So if it is a birthing person that may have been a survivor, if it's a birthing person that could be recovering from cancer, or currently getting ready to go through some chemo and radiation, in addition to being a new mother, there's a lot of things that there can be a complex or an intersection of reasons why support groups are necessary. But I champion breastfeeding. I champion breastfeeding support groups. Luckily, within the pandemic, if you have Wi-Fi or a smartphone, you have Facebook. There are Facebook groups, or on Instagram, if you just put in hashtag breastfeeding, hashtag
Healthy Savannah, Deidre Grimm and her team do, Dr. Nandi, they do a fantastic job with advocating for breastfeeding, for advocating for women of color, for removing the stigma. Healthy Savannah does a fantastic job. I will tell you, ladies, we could probably stay here for the rest of the night and continue to have these conversations because they're so critical. I want to turn it over to each of you as we prepare to close it out. I do want to say a huge thank you to everyone that is tuned in. Thank you, Carmen. Thank you, Charlotte. Thank you, Alondia. Thank you so much. I think the list goes on and on for everyone who has literally hopped in the comments, shared with us your experience, shared with us the realities of your journey, because that's the exact, I think that just getting real, the more informed you are, the more you trust yourself, the more that you know that there are people who are out here fighting for your success, the health of your baby, the success of your family, the more you will know how much you are supported, how valuable you are. And it's just not about getting to the other side of loss, the other side of having life. But if you watch the very first episode where we talked about losing babies and going through the trauma of miscarriages, one of the most loving things that my husband said to me was, I want you to be healthy. So no matter what we go through in our family planning, you being here and you being alive and your care matters as much as our family goals. And that's the reality, that the people who are loving on you, the people who are in your life, your partner, your spouse, you name it, that they are there to walk through this journey with you. And if you do not have someone to walk through this journey with you, that you have people who will literally hold your hand, virtually hold your hand, to support and wrap their love and wrap health and wrap care and advocacy around you in the delivery room and also in the state capitol in our country's capital for you. So ladies, I want people to get connected to you. Victoria, your whole experience, almost losing you, which I can't even imagine, birth your 140 over 90 run. This is literally your second child. We love Madison. Madison has a little sister named the 140 over 90 run.
She does, yes.
all of our viewers to participate and tell them what this 140/90 run, how you're doing it. And then Lauren, we're going to hop back to you so people can get connected to you and they can have these conversations, because while I do recognize that we're in an open platform, that so many of you want to have some one-on-one time with Lauren, with Victoria, and that's exactly why we're here this afternoon. So Victoria, I'll turn it over to you, please.
Sure. Thank you. So the 140/90 is a benefit for the Preeclampsia Foundation. And the name is the blood pressure threshold where preeclampsia starts along with other symptoms. So 140/90. And what it is there are virtual options, 365 days out of the year. You can do 140 miles over 90 days or a 5K whenever you would like, wherever you are. But there's also going to be a 5K, fingers crossed, next June 19th, 2021 in Melbourne, Florida, which is home of the Preeclampsia Foundation. All the money raised benefits a vision grant, which is research-based for innovative research, and also access to blood pressure cuffs. So a blood pressure cuff that saved my life. We want other women to have access to blood pressure cuffs that might not have the funds, transportation, etc. We want to make sure that pregnant and new moms within 6 weeks of pregnancy or delivery have access to blood pressure cuffs. So 140/90run.com. We're on social media, Facebook. My personal handle for Instagram is VT Buker, Buker on Instagram. I post a lot of advocacy on there too, mental health, postpartum, etc. And would love to connect with you all. And if you have any questions on preeclampsia or how to get involved, we'd love to have you all run, walk, move. You can Zumba, you can spin, you can do whatever you'd like to get in your miles. We really just want our survivors and everyone to be heart healthy, because as I mentioned before, preeclampsia and HELP survivors are at a much higher risk of having heart disease and stroke later on in life. And we want to make sure that all our mamas are there to enjoy their babies and their families for a long time.
And Lauren, go ahead and let them know how they can connect to, again, all of the amazing work of the Doulas of Capitol Hill. I'm going to go ahead and bring up your contact information again as well, please.
Thank you. Again, I am absolutely ecstatic to share any resources and knowledge I have with expecting moms or those that are family planning. I am Lauren, the Birth Doula. That is my handle on Instagram. So you'll see that on the screen, at Lauren, the Birth Doula. The best way to contact me also is through my Facebook. Same thing, Lauren, the Birth Doula. Sankofa Maternal Care Services is my personal doula service, but I am an independent contractor with the Doulas of Capitol Hill. So for any service beyond just being the birth and postpartum doula, my agency right here in the DC metro area provides virtual support across the country. So we can tap in. I can provide virtual support, whether you are in the US, you are in Saudi Arabia, you are on vacation in Tulum, because that's really where everybody's going right now. I'm excited to partner with, yeah, it is. But I'm happy to also connect and schedule consultation via email. That is the best method, through any of my social media. Also, I'll provide my phone number. If any of you throw a request for contact in the chat, I will follow up with you directly. But no matter where you live, if you have access to Google and Facebook, you have access to a doula. We are a community of strong people. Especially if you are a Black or brown mother, I encourage you, do not believe you are stuck in with your current OB and that what they say is the only way to go. You have choices, you have rights. You also have a doula that is willing and waiting to join you and help along the process, because it is your body, it's your birth, and it's your baby. So again, I'm Lauren Graves, based in Fairfax, Virginia, and I am a doula of Capitol Hill, and I hope to be able to help heal and to also save lives through education and advocacy. Thanks, Mia, for having us on.
God. Yes, thank you.
I feel like so many future lives are being saved. I feel like you have granted so many permissions, ladies, to everyone that tuned in, like, oh, okay, I can set my boundaries for the delivery room. I can set the tone with how I need to go into this. I can reach out to someone when I don't feel like myself. As I walk through anxiety, as I walk through my postpartum concerns, I literally, Sade hit the comments and she said, blood pressure cuff saved my life. Like, so that was so hard. I cannot say thank you enough, Lauren and Victoria. You ladies live your life in service. And I hope that every person that's watching knows your family is valuable, your health is valuable, your womb is valuable, your family, how your family looks, your family goals, every part of that matters. And that's why we had this conversation this afternoon. If you missed any of this talk, you can rewatch the entire thing all over again right here on Facebook. Please share this talk. Please share this amongst all of your healthcare professionals, midwives groups, you name it, you tag, share this with an expectant mama. You can keep up with past talks, www.miatalks.com. The list of people who have just poured into others, I cannot express my gratitude enough. Thank you for allowing these talks to happen and for my company to bring them to you. All right, ladies, we're going to say goodbye and send love. Stand by. Y'all ready?
Yes, bye. Thank you.
Thank you.
Thank you so much.